morning all. Today we'll be discussing about complex regional pain syndrome. So this is the start of e-learning. At the end of the lecture, just let me know how was your experience about this lecture. The other names for CRPS is Sudex atrophy and shoulder hand syndrome that we commonly use it. Classification, that is CRPS, can be classified into two, CRPS type 1 and CRPS type 2. CRPS type 1 is even known as reflex sympathetic dystrophy that develops after any noxious event. There is spontaneous pain or allodynia or hyperalgesia, that is patient is having increased sensitivity to pain, edema, vascular abnormalities, abnormal pseudomotor activity, and it is not related to any nerve injury. Whereas CRPS type 2, the other name for that is causalgia, that develops after the nerve injury, not limited to the territory of the injured nerve. There may be edema, skin blood flow abnormality, abnormal pseudomotor activity may be present even in causalgia. Clinical features, the symptoms are more marked distally in the extremity and they progress in intensity and they spread to proximal parts even. Etiology and symptoms, they usually develop in association with a persistent painful lesion such as painful shoulder after a cardiovascular accident or myocardial infarction, cervical osteoarthritis, that is cervical spondylitis, after trauma such as fracture or sprain, burns or immobilization, and after surgery or cardiac catheterization. I would like to inform that CRPS, that is RSD or causalgia, that are not limited to only upper extremity. They are even found in the lower extremity even. There may or may not be any obvious nerve lesions. The sympathetic nervous system is usually involved in CRPS type 1, that is RSD. There are three stages of CRPS type 1 RSD. That stage 1 is acute reversible stage. In this stage this is the stage of vasodilation that lasts for 3 weeks to 6 months. Pain is present. There is hyperhidrosis, that is increased sweating, warmth, edema, rapid nail growth, and edema in the distal extremity. It is important to recognize the early symptoms because early intervention may prevent the progression. So as earlier the CRPS is diagnosed and the intervention is carried out, it is better for the prognosis. Stage 2 is dystrophic or vasoconstriction stage, that is ischemic stage. It lasts for 3 to 6 months and it is characterized by sympathetic hyperactivity, burning pain, and hyperesthesia exacerbated by cold weather. There is mottling and coldness, brittle nails, and osteoporosis. Stage 3 is atrophic stage. It is characterized by pain, either it may be decreasing or become worse, and patient may have severe osteoporosis. Muscle wasting and contractures may also develop. The condition may last for months or years, but spontaneous recovery often occurs within 18 to 24 months. Common impairments, that is patient is having pain or hyperesthesia at shoulder, wrist and hand. Limitation of motion, that is range of motion is limited. In shoulder, typically the restriction is with lateral rotation and abduction. In wrist, the most common restrictions are limited with wrist extension and MCP and PIP flexion. Edema of hand and wrist are secondary to the circulatory impairment of venous and lymphatic systems. Trophic changes in the skin may be present. The skin becomes cyanotic and shiny. Intrinsic muscles of hand are atrophied. Subcutaneous tissues in fingers and palmar fascia thicken. Nail changes occur and osteoporosis develops. So as you all had covered up the symptoms, now we can go with the management. The first and foremost thing is early intervention. That is, the best intervention is the prevention. And for best intervention, it is to be diagnosed at the earlier stage. It requires that the therapist motivate the patient to move the entire extremity safely within the tolerance of the patient and within the patient's availability of range of motion. Elevation and movement of distal segment is also important at the earlier stage. That is, if it is upper extremity, you ask the patient to squeeze and open up the hand. That is, you can ask the patient to make the fist and open up the fist. Ankle pumping and toe curls are good exercises for lower extremity lesions. For stage 1, pain and edema control can be done by, pain is mainly managed by your TENS, that is TENS modality. For edema control, you can go on with massage, and there are the technique used in massage for edema control is your effleurage can be helpful to drain out the edema. You can even use your elevation and elastic compression also to decrease the edema. For mobility, in the earlier stage, use gentle active exercise to manage the increasing stiffness. That is, only, I would add, gentle, pain-free active exercises. Support and have the patient actively move each joint for a short period of time. That is, within the pain-free range, within pain-free available range, whatever the patient is comfortable, you can ask them to move that part in that particular range. If it is hand, you can include your tendon gliding exercises. For hand, you can go with your nerve mobilization techniques. That is, nerve mobilization techniques. For upper extremity, you can say, you can use your upper limb tension test, and in that you can move the distal part. So that will mobilize your nerve. That is, if you are using your ULDT1, you just move your wrist joint at the last stage. That if wrist goes into flexion and extension, that will move the nerve completely. If you are using for the lower limb nerve mobilization technique, your SLR techniques can be used and for the nerve mobilization. So in that, if you just move your ankle joint into dorsiflexion and plantar flexion, that will also mobilize the nerves for the lower extremity. Muscle performance, facilitate active muscle contraction, that is, include joints proximal to the symptoms, shoulder, for example, shoulder and the head. Use both dynamic and isometric exercises. Can be used. Loading the extremity is also important. That is, if it is upper extremity, you can go with the quadruped position. That leads to the weight bearing position of the upper limb. You can begin with the 3 minutes and then increase it up to 10 minutes 3 times a day. And for lower extremity, you can utilize progressive weight bearing activities. Distraction by carrying 1 to 5 pounds up to 10 minutes at a time frequently throughout the day can also help in this kind of patients. That is, approximation and distraction technique. Desensitization, have the patient work with various textures and tap or vibration over the sensitive area. Patient education, that is, teach gentle exercise for shorter period of time throughout the day and use of associated parts of the extremity. Precaution, do not exacerbate patient's pain. That is, everything should be carried out within pain-free range of motion and under the patient's tolerance. Maintain continuous contact to avoid the irritation, especially when you are using your massage techniques for edema control. Don't do such that if you are giving effleurage, suddenly in middle of the technique you are lifting your hand and again you are making a contact. So don't do make and break. That is, you continuously give the massage. These instructions are part of your massage techniques as well. So continuous contact should be maintained throughout the technique. When the patient presents with hypersensitivity, painful stretching and manipulations exacerbate the symptoms. In stage 2 and 3, pain management modalities, any modalities that helps to reduce the pain, most preferable is TENS. Desensitization, progress the desensitization techniques to increase patient's tolerance to various textures. That is, whatever you did in stage 1, you can progress that thing in stage 2 and 3. Mobility, used joint mobilization, neuromobilization and stretching techniques, but I would suggest joint mobilization and stretching techniques should be precautiously given in this patient because stage 2 and stage 3 includes the patients having osteoporosis also. So this technique should not be vigorously given in the patient. Muscle performance. Develop an exercise program to improve strength, endurance, and overall functional performance that meets the patient's specific needs. So whatever the need of the patient is, you accordingly plan the exercise treatment. Precaution. Use caution with stretching and resisted exercise due to osteoporosis.